Republicans are set now on a couple of key votes that could take place as early as tomorrow on that issue and on a health care repeal and replace effort that will, we are told, include coverage for pre-existing conditions. But again, some of the conservatives are annoyed with the concessions that have been made to moderates because that coverage should be left up to the states, they say, and if that means that potentially some people are denied coverage or pay through the nose for that coverage, so be it. So you can see where this is going here, but one way or the other, they want to try to get this thing voted on and put people out there on record. So where does all of this stand? Let's go to Gerri Willis. We also have cardiologist Dr. Campbell. So, doctor, to you first on this notion of pre-existing conditions and coverage. Some people have a real problem leaving that up to states, that they're, even in this party, very big on states' rights and all of that. This is one thing that the federal government should backstop. Do you agree with that?
You know, I have real concerns about leaving this to the states. There's very little about the Affordable Care Act I like, but I do like the pre-existing coverage. And I am worried that if you leave this to the states, patients are going to be priced out, they're going to have no care, and ultimately it's going to be even more expensive because they're going to get no care and show up in extreme distress.
You know, Gerri, fortunately, you've made this a very big cause in terms of what you've been personally going through, battling cancer. There is a possibility under such a plan that depending on the state you live, you could get coverage, you might not get coverage. So it always comes back to that. Or is it that black and white? What do you think?
Well, Neil, listen, this is obviously a cause very important to me, and I know to you as well. We've both had our health care battles, and we want to see people get coverage. As I understand it, what's going on right now, yes, states can opt out, but they can only opt out if they come up with a plan that is better and works. So this idea of high-risk pools, there is, though, a very big problem with those. And let me tell you specifically what it is. The Republicans say they're putting more money towards this idea. And you're really talking about covering 2 to 3 million Americans who have very big, high-priced medical bills. In one state alone, in Iowa, one patient costs that state $1 million a month. So how do you solve for that? How much money would it take? $200 billion, conservative estimate over 10 years. This bill, as it's being proposed right now, does not propose $200 billion. It's something much less than that, even with the $8 billion extra that Fred Upton suggested today. Neil?
You know, Doctor, you're a cardiologist, and I know very well that that's a challenging profession, and you're the smartest of the smart, just in that study. So let me ask you about the expense, because that is, when you've got cardio-related issues, they could be pricey. And especially if you have a past and history of them, then getting follow-up coverage is going to cost you more. Do you think high-risk pools, however they're paid for, are the answer? Because those pools themselves could be very pricey, and we would be replacing one big omnibus program with another big omnibus program.
You know, I think you said it right there. I think we're trading one bad choice for another, because you're right. Cardiovascular disease is the #1 killer in the U.S. today. It's very expensive to treat this. However, if we actually focus on prevention, preventing heart disease by working on preventing diabetes and high blood pressure and things of that sort, we can lower these costs. And, you know, these patients are not going to be that expensive. From personal experience, my daughter has type 1 diabetes, and she's had it since she was 5 years old. And without insurance, it's almost unaffordable to keep her healthy and well. She's 16 now, but luckily I have insurance.
You know, my problem with the whole preventive thing, doctor, is I discovered in the process that there's this thing called the food pyramid, and I didn't have to be reminded about that, but I hear where you're coming from. But, Gerri, you know, that will be the issue here, whether Republicans, for all of this back and forth, have still stuck to the basic principles, the things that we like about Obamacare, coverage for pre-existing conditions, maybe keeping your kid on policy a little bit longer, you can never get turned down, all of that stuff, but that the costs will still, to the doctor's point, be substantial. Then why make the move at all?
Well, the costs will be substantial. There's no doubt about it. And let's be very clear, crystal clear about what we're talking about here. With the risk pools, the costs go to the government. The people paying for their insurance coverage wouldn't notice any difference. Those costs would be borne by the government. That's what they're talking about right now. This is what could happen. We're just not sure. We're talking about a very different paradigm than existed before Obamacare. And to the good doctor's point, Kevin's a very good friend of mine. prevention is everything. Prevention is great, but sometimes there are some diseases you can't prevent. You hear about for the first time in the doctor's office, and you have to deal with it right there and right then.
Yeah, there's no one healthier than you before you were diagnosed. So me, I had it coming. I left it at that. But guys, thank you both very, very much. Interesting read.